Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. This is the Metabolic series to help you understand what could be going on metabolically. This is video number 2 in the Metabolic series. So we talked about in the first video, we talked about thyroid metabolism and what the normal process for that was, and how the body, patients could have totally normal values, whether it's with or without medication. They could still have totally normal lab values but still feel horrible. So I told you in that video that we were going to get into why that could happen. So basically what happens is when the thyroid gland makes T4 and T3, and this whole pathway here, and in the blue is what we talked about in the last video. T4 is about 93% of what the thyroid makes. T4 is inactive. The body cannot use T4. T3 is about 7% of what the thyroid makes, and that is active. So this T3 that is formed, this goes on and goes into the cells and is used for metabolic conversion into fuel. But T4, there's nothing the body can do with that. So 93% of what your thyroid gland makes cannot be used by the body. When you're taking Synthroid and levothyroxine, or these medications that are synthetic T4, they're raising the T4 level, but they are not affecting your overall metabolic output, because T4 has to get onto thyroid binding globulin, and it goes out to the liver, to the gut, to the kidneys, and to all the other tissues in the body. And in these areas, that's where the conversion of T4 to T3 happens, and then you have 93% of your metabolic output here. So the answer to the question of why do you still feel so poorly even though your lab tests are normal, answer to that question comes in because you got T4 that cannot be used. So your labs may be totally normal, but you're not converting that into metabolic output. So let's say that there's something blocking thyroid binding or T4 from binding to thyroid binding globulin. That's going to keep you with low metabolic output. Let's say that the T4 does get onto the thyroid binding globulin, but it gets out to the liver, the gut, the kidneys, some of the other tissues, and maybe there's something going on in those areas that can cause you to not be functioning optimally. In fact, the liver and the gut combined, that is 80%. 80% of the conversion of T4 to T3 between those two organ systems. And a lot of patients have very, very toxic livers because of diet, because of medications, because of environmental toxins. A lot of patients have digestive issues because of decreased hydrochloric acid levels, because of leaky gut syndrome, because of SIBO, because of dysbiosis. So breakdowns in these areas not only cause digestive disorders and liver symptoms and so on and so forth, but they also can cause underconversion of T4 to T3, which is going to lead to this underconversion aspect. So this is very important. So your labs can be totally normal, but those labs will not represent what's going on down here. So you have to, number one, you have to run extensive labs to see what the T3 levels are doing and how they're getting into the cell and so on and so forth. But you also have to understand that this is just a very small part of the picture. You've got to see how is the liver functioning. You've got to see how is your digestive tract functioning. What are your hydrochloric acid levels? Do you have a potentiality of leaky gut syndrome? Are there food sensitivities? Do you have dysbiosis? Do you have parasitic infections? What's going on with your digestive tract? Are your kidneys being affected because of blood sugar dysregulation, and so on and so forth? So all these areas have to be looked at, and that alone will make a huge difference in the metabolic pathway. 70% of the patients that we see in our office that have a thyroid diagnosis, hypothyroidism, Hashimoto's disease, something along those lines, 70% of those patients do not have a thyroid condition. They have some kind of other metabolic imbalance that's causing them to have underconversion of these factors and is leading to those hypothyroid symptoms. So this is really, really important to understand, and this is critical for you as you move forward through this metabolic pathway. So in the next video, we're going to get into some more factors that can complicate this, and we'll see you on the next video.